Welcome to week 13 in our course. This week we address the framework that holds everything together: policies, procedures, and record keeping. Why clear policies and procedures ensure that we have consistency in operations, provide staffing guidance for decision making, protect the facilities legally, create accountability, enhance member experience, and reduce confusion and conflict. Without written policies, every situation becomes a crisis. Let me define what are policies and procedures. Policies define what will be done and why. The rules, procedures define how it will be done or the steps. For example, policy: all members must complete health screening before participation. Our procedure is 1. Members receive screening form at registration. 2. Staff reviews completed form. And 3. High-risk members are referred for medical clearance. So some essential operating policies. Our facility needs written policies for the following areas: membership categories and fees, hours of operation, member conduct and dress code, guest and visitor policies, cancellation and refund policies, supervision requirements, age, usage rules, children's policies, photography and media policies, and complaints and grievance policies. We also need to have specific safety policies that address the following: pre-participation screening requirements, informed consent and waivers, emergency response protocols, incident reporting, equipment restrictions both on age and ability, spotting requirements, cleanliness and sanitation, prohibitive substance and behaviors. Need to have staff policies. Need guidance on professional conduct standards, dress code and appearance, client relationships and boundaries, social media and communication, continuing education requirements, performance expectations, disciplinary procedures, leave and attendance policies. All these are important for our staff. We also need to have effective procedures on. They need to be step by step. We need clear, essential, sequential actions. They need to be specific, no ambiguity in expectations. Assignable, identify who does what. Measurable, can verify completion for all these things on these procedures. And renewable, how often do they need to be updated? Policies only work if people know about them. So we should have a member handbook at registration. Need to have a staff manual at hiring. These policies need to be posted in visible locations, also on our websites and online. We need to review them and acknowledge them. And we need to have training on policy changes anytime we make changes on our policies. Documents serve multiple resources. So we need to keep records for the following reasons: for legal protection, quality assurance, performance tracking, historical reference, compliance demonstration, and communication between staff. The essential records categories: we maintain comprehensive records for the following: member records, screening, consent, assessment, and participation. For staff records, credentials, training, performance, and incidents that we have. Facility records, inspections, maintenance, repairs, and improvements, financial records, revenue, expenses, payroll, and taxes, and finally, operational records, attendance, utilization, programs, and incidents. Different records have different retention periods. Permanent records are facility design, major renovation, and annual reports. 7 years are tax documents, financial records, and contracts. 3 to 5 years, member files after termination, staff files after departure. It varies by incidents, such as incident reports or injury reports and legal matters. Know your state requirements. They may differ, and this is where the lawyer will be beneficial. Document best practices. Be timely. Record information immediately. Be factual. Stick to observational facts, not interpretation. Be complete. Include all relevant details. Be professional. Use appropriate language. Be secure. Protect confidential information. And be systematic. Use standardized forms and procedures. Digital records management. Modern facilities use electronic record systems now. We can use a cloud-based membership management. We can store our documents digitally. We can use electronic signatures. We definitely need to have automatic backups. We need to have access controls and audit trails, and everything needs to be in HIPAA compliant platforms. Ensure system meets security and compliance requirements. This is where our tech or IT people come in and to be helpful. This week's assignment, you're going to be developing an operation manuals, policy, and record keeping system. Again, we have detailed assignment directions. This week you have a Chapter 8 practice quiz. Again, those quizzes aren't worth anything to help you on your, this one will be for your final exam. And you're going to be reading Chapter 11 in Encouraging Calling. We're getting close to the end of the book and the end of our class. And we'll have a fantastic discussion on Chapter 11, Encouraging Calling. As always, if you have questions, please ask.